Today I'll speak about the osteoarthritis, what is called common it as a knee joint pain. So why you will get the problem at the knee joints? This is measure of two factors. One, it is age related. Second, it is previous any trauma or any pathological conditions. So both the things would be come out to the shape of this one osteoarthritis. The previous pathological cause will be common in younger stage. If will some kind of any injury to the previous, say 5 years or 10 years back or 1 year back, it's a long term. You will give a gap. You have mild pain at the knee joint, but still you keep on continue walking, moving around, doing exercise, doing your as usual regular activities. What it does, it is then slowly, because maybe you have got up injury either your ligament or your meniscus or any soft tissues or in cartilage. This will damage, mild damage will give you chronic problems because it has a wear and tear when it keeps moving out the around. Suppose take an examples, you have an injury at the this side, this one ligament or in the central ligament or either any ligaments which gives strengthening your joints. Maybe you have the mild injury, but you will keep on moving around, then you will keep on walking. Then what it happens, it is day by day, degeneration process, that inflammations goes more. So in the inflammation will turn to as a regular process that we turn as a degenerations. So that will lead to the osteoarthritis, which happens only in the aging process. That is when you have the crosses more than 60 to 70. Then slowly due to the aging process, the cartilage will get this one, the thinning. Then because of the weight bearing, as this is only joints which bears your all your weight, and during the climbing. So climbing, what happens, you need to bear your weight on alternate legs. So that takes your one leg takes your full body weight. Then what happens? Then the degeneration process will go faster. So that is what happens in age-related osteoarthritis. But in case of previous very pathological condition, what happens? People neglect it. That is case of negligence. If you don't treat your either your ligament injury or your meniscus injuries or your cartilage injury, if you don't treat it at the early stage, then that slowly prolong it, again will land up with degeneration. Again, that also called as osteoarthritis. So that is called early osteoarthritis, when you will have predisposing factor of any pathological conditions, and second is your age related. But treatment again will come this one, both the cases the same kind of treatments. When we enter with the degenerations. But before the degenerations, if you have kind of only ligament injuries or meniscus injury, the treatment modalities will be different. But unfortunately, everybody will treat knee joints pain. Okay, the treatment mode of approach will give the same scenarios. So that what happens, you will have the temporary relief, then again you will have the recurrent problems. Suppose your cartilage is intact, your meniscus is completely intact, only you have ligament, then you need to go for this one. If the ligament is mild injury, go for the rest and the treatment, medical treatment. If it's suppose it is 75 to 80% of the injury damage to the ligament, then you need to go for the reconstruction of the ligament. So that will gives you completely better, completely healthy knee joints. But in case if you land with a degeneration because of the ligament injury, you are weight bearing these joints. So slowly what happens? In between the substructure, you can see this will starts thinning. That will continue degeneration. So once you have the degeneration, it will term as a osteoarthritis. So again, how it will happen during the aging process? It is happens in the same things due to the predisposing factor of any pathological condition or any injuries. That two things. But again, this the treatment of approach what happens it is exactly in both the cases will be different. If it's this your muscles power, it's normal. You don't have any atrophy of the muscles which happen in other scenario in the geriatric patients because there is muscular atrophy and the muscular power will come down. Then the support which is supporting your joints, then it cannot able to take that much load to your joints. So you treat it different both of things. So obviously, so treatment approach will be different as per the age related. Then how to exactly find it out? This one it is simple test. We'll do an X-ray. What it does it shows. So this is what it happens. It is in the space. In the space already there will be structure should be like this. Your cartilages, your meniscus and the ligament. When the space will reduce it, that means it indicates your joint space has reduced. It means you started getting degeneration process. Like this, like an example of this picture. Since it's almost the joint space has completely reduced, and with it have this one degeneration of the bones. So this case almost is a chronic stage. We need to go for this one, replacement of the knee joints. It depends what kind of eye you have. Either is a total replacement or partial replacement. Then again, what is the mode of treatment? How to do it is, there is regular scenario. Everybody will have the treatment knee joint pain. Started to take it the non-steroid NSAIDs and with few exercise. But exercise, as my experience and knowledge, exercise I don't recommend when you have the pain. Why? Because exercise again you start moving your joints. Any exercise you do for the knee joints or walking more, again whatever you are moving your joints. So first you have already your damage, which is cannot when you will have the pain because the load which is from all your joint, this one body completely not able to bear it. That reason you get the pain. Top of that, again you are moving it. Any kind of exercise you do it will be always start giving your strain to your ligaments and joint structures. So you have the previously pain, then again if you do exercise, so obviously the pain will increase it. Maybe during the time of a walking exercise you feel mild better because it gives a little bit of relaxation to the immediate. You have the spontaneous blood circulation which goes to your joints, it will give for time being relaxation. But again after a few hours it will have the same scenario. Then what is the exact treatment? What will approach of treatment to do it is, first try to do what of the structure is remaining, which is already damaged, nothing can be done. Then what is the structure is remaining? We need to strengthen that structure first. So strengthening obviously first role is rest, immobilization of the joint. We cannot do complete immobilizations because there is no fracture and this will give you again the tightness of your muscular structures. So complete immobilization is not at all advised. Its only thing is to reduce your weight bearing on that leg. How much is possible you can. It's not completely you need to have a bed rest because there is not easy chronic problem. So it's acute means you need to have a bed rest. This is a chronic. So it's what we call always is we are speaking about osteoarthritis. Osteoarthritis, it is a degeneration. So degeneration is a chronic process. It is long time. So completely rest is not advisable. So this rest is how much is possible to reduce the weight bearing on that particular affected leg. Then what happens it is the further damage will come down. Second thing, so we need to give the strengthening. Particular, we need to give supplements of glucosamines, which will strengthen your structures, all your the meniscus and cartilage will give the glucosamines, which will increase the strength of the structures. Which nobody will prescribe that things, very rare condition will prescribe it. But I prescribe it is more at the success rate which is very high in this. Because this glucosamine with combination of vitamin D plus again with stimulator to the neuromuscular junctions, that is either called benfotiamines or folic acids or alpha-lipoic acids. And obviously depend on the pain structure. This one, instead of giving the NSAID, this one instead of giving the COX-2 inhibitors. COX-2 inhibitors will have, does not need an PPI because you will have any NSAID. This because you need to give a long term. This is a degenerative. We cannot achieve our goal within a short span. So we need to, whatever supplements, whatever the medication we are giving it is, we need to give it a long term one. So NSAID obviously we need to add an PPI because it causes GI irritations. So better to avoid that one. We need to give COX-2 inhibitors, which will reduce the inflammations and does not need another to add another PPI. So what will happen? You will strengthen the structural components of all the joint surrounding structures. You will slowly start giving strengthening. So once the pain intensity of the pain has come down, then we need to start doing slow exercise to increase the flexibility fast. Yeah, patient is now feeling better, is now almost 60% is pain free. Then light flexibility exercise, which will slowly stretch the ligaments. Then okay, fine, doing patient is well. The next step we need to go for this, the strengthening of the muscular structures. Okay, then this fine patient doing, then you will slowly keep on doing slow walk, because that again will start bearing 50% weight. After that, okay, now it's getting recovered, fine. Then you start doing static quadricep exercise. So starting quadricep exercise, it will give strengthening all your joint structure in the knee. So that does not again to further, it won't allow to deterioration again or reduce the process of degeneration. So then what happens? Now it is completely better, pain has reduced, but the extent of pain it is reduced. If it is 100% fine, then it's okay, no problem. The patient as usual can do walking and other activity. But keep in mind not to cross it or fold your knee and avoid sitting on the floor. Because maximum they will think, I'm fine, I can do everything, all the work sitting on the again sitting, because now you recovered and your structure just got strengthened. So if you start stretching or folding your leg and sitting, then what happens again will have almost 95% recurrent of the same pains. So try to avoid at least for the 6 months folding your knees, how much is possible. Then slowly keep on doing your regular work. Then okay, till 6 months I don't have any problem, and you are out of completely supplements, because the supplement does not we don't stop it immediately. We need to, okay, patient is now pain free, then you have to give a maintenance dose for at least 6 months, not to get it further deterioration of the degeneration process. Okay, 6 months is fine. Then we will start doing little bit of putting the pressure on the knee joint as try to folding the knee joints. So slowly folding on the knee joint only during standing, not on the sitting posture. So standing then the side structures will get little stretch, and your muscles always you have strengthened doing static exercise. Then you will start doing folding. Then once you start folding, from 90 degree to again slowly you start squatting. Okay, then you don't have any pain, you're not completely better. So then after that you can slowly fold your leg and sit on the floor. This is a common treatment regular procedures. So exercise, then continue it regular the exercise to maintain it. So always remember, when you have degeneration process, you will feel the pain at the initial stage, because maximum what to do it is a wrong conception. So they will start doing the exercise. So exercise only not to get in future for the particular the knee joints pain, osteoarthritis, not to get cure from that. So this is very important things. Always one should be remember it. But if you do during the process of the pain, you have the pain, if you do the walking and exercise more, obviously you will end up with more damage to your knee joints. So this is basic treatment protocols and basic care for the knee joints. Yeah, when you will have the chronic, when basic medicine patient does not respond to all kind of procedures and treatments, then there is only one option. We have to go for this one, knee replacement. It depends on how much extent of damage. Then we will decide either is need a partial knee replacement or is a TKR, that's total knee replacement. So that is on the last stage we go for that, but not on the initial stage. Initial stage always will give the conservative management. If the patient feels better with conservative management, then it's the best treatment as far as my things. But not at the early stage, I don't advise for going for this one knee replacement. If the conservative treatment fails to achieve the improvement, then obviously there is no alternative. We need to go for this one complete or partial knee replacement surgery. Okay. Thank you.